Good morning. This is Dr. Beck here at Life Point Medical. It is July the 21st, 2021, and we're up and running today. I'm flying solo, so we're going to get you taken care of and get you seen. Just remember, it's me by myself, so I'm good with it. I've worked many years by myself, but if you need something, let us know. So I want to talk to you a couple things, just cover a couple things. First of all, I'm getting feedback because I have let the office know that I want the women's wellnesses done in the women's wellness clinic, and I guess some people are taking it personally, and I don't even know who they are in general. Okay, but I'm just going to let you know that is me trying to manipulate the flow around here to best serve the patients, and I wanted to have the wellnesses done in the women's clinic in case you needed a service that was specific to that area. And actually, we'll be announcing a new service there that everybody, I think, is going to be happy with here shortly, related to cancer prevention. I just haven't got it all straightened out yet, but I'm talking to somebody on Friday about that, and that will make us more complete women's clinic. And so it's nothing personal, and I want the wellnesses done over there. So if you do need a pap smear or something like that, you can get it done instantly. Now, I will tell you that these consultants that we've been having come in and talk to me, one of the things they pointed out is they're like, Dr. Beck, you don't need to actually do the wellness visits. Those are not a mandate for a provider per se, in the sense that it's a checklist of things that we talk about, but there's not clinical judgment in those things. It's more about age and what you've had and what you haven't have done. So there's no real clinical judgment there. Sometimes there will be a clinical judgment issue, and that is perfectly fine for me to help you address. Okay, but the annual wellness visits themselves can be done without much provider input. Now, I put in lots of input on what they need to be asking and what the standards are, and we follow the U.S. Preventive Task Force when it comes to what you get and when you get it and stuff like that. So that is my stamp of approval on that, but it does not necessitate me to actually do those for you. Now, if you've got other problems, or we've got stuff that does need somebody with clinical judgment, that's where I come in, and I'm more than happy to help with that, because that's what I do all day, every day, and that's what I've been trained to do. So anyway, please don't take it offensively. We're just trying to make this the best clinic we can, and I want women to understand that there's a wellness clinic here. I want them to be familiar with it. I want them to use it, and I still do some women's care over here. Okay, I'm a doctor. I take care of everybody. The interesting thing is I usually have worked hand in hand with an OBGYN since I got out of residency. So I really haven't done a lot of it in years, and that's why I hired somebody who was up to date on it and was doing it, and that's Monique. And I'm trying to parcel out that in an appropriate manner to get you taken care of, and it's me trying to do the best for the community as I can. So thank you in advance, and I hope you understand it. And if you have stuff that needs clinical judgment, set up an appointment on my side, and we will take care of it. I promise you. One thing I want to talk about, weight loss, real quick. People. We do have our weight loss program. We are monitoring people. We use some very mild drugs for that. And if you're interested in it, we are here for you. I do think that lots of people that come into this clinic will benefit greatly if they lost weight. And I want to help you do that. Okay, and I mean by benefits, I mean longer life, less pain, more mobility, better self-image, whole 9 yards. So we want to help with that. That's all. We want to help you improve your life. So give us a call if you want us to help you with your weight loss management. And I've got a few tricks up my sleeve and some things that I know that work and what things that don't work. I know a lot of them. So great. Come on in if you need to. As far as COVID-19, 1,605 cases. So we grabbed a few more overnight. And then there was one more death. Now, I don't know who that death was, and I'm sad, but still, it's just kind of lingering around, and we're trying to continuously monitor our situation. I don't want to lock the door again, but I hope we don't go backwards on this thing. Certainly, I do recommend the vaccination for appropriate age groups, 50 and older for sure, or if you work in the health field or somewhere where you're going to be exposed to it, and particularly if you've got other medical problems like cancer or severe obesity or diabetes or heart disease, anything like that, I want you to get the vaccination, okay? Because I don't want you to succumb unnecessarily to an illness. And so anyway, we're keeping our eyes open, and just continue to use that hand sanitizer, honestly, and mask use. A lot of people are wearing their mask. A lot of people are not. So we're just going to keep our eye on the situation and try to do our best we can. Okay. All right. We're up and running. Let us know if you need anything. We're answering the phone, and we'll get you taken care of. Other than that, I want you to enjoy this wonderful Wednesday. Have a great day. Thank you.